Daylight savings just ended, and I need to bust the myth I hear every single year in my practice. If you're Black, you don't need more sun. Or from my autistic patients, I'll be fine staying indoors where it's comfortable. Meanwhile, the brain fog is getting worse, the moods are crashing, the exhaustion feels unbearable, and nobody connects the dots. This is a special episode for my Black and late diagnosed autistic sisters because the myth is keeping you sick and the science tells a completely different story. I'm Dr. Stacey, a board certified surgeon and a late diagnosed autistic woman who is currently going through perimenopause, and everything I thought I knew about my own body and my patient's body had to be rewritten. So when I hear these myths floating around, Black women don't need vitamin D. Autistic women are fine avoiding the outdoors. I know exactly what's happening. And we're being dismissed again. And it's costing us our clarity, our mood, and our energy. Here's the truth in plain words, no medical jargon, just facts. First, melanin is beautiful. It's also protective and it filters UVB light, which means many Black women make less vitamin D from the same amount of sun exposure. You're not imagining it. The research is clear. Black women often test lower for vitamin D, and we need more sun exposure to produce the same levels as lighter skinned women. Second, autistic women are at higher risk too because many of us are indoors because of our routines, remote work, avoiding overstimulating environments. What this means, less sun exposure. And when vitamin D levels drop, our nervous systems feel it first. Brain fog, word loss, mood instability. And third, add perimenopause to this picture. Estrogen levels are dropping, and vitamin D, it acts like a hormone. It signals throughout our bodies, in our brains, in our bones, in our immune systems. When estrogen is a little wobbly and vitamin D is low, your brain feels extra tender. The fog isn't in your head, it's biochemistry. I had a patient, a late diagnosed autistic woman in her mid 40s who came in last November saying, Dr. Stacey, I thought I was losing my mind. The clocks changed, and suddenly I couldn't remember conversations from this morning. I felt like I was underwater. We checked her vitamin D. It was low, severely deficient. She had been told for years that she did not need to worry about sun because of her skin. She had been working from home, staying inside, eating clean, doing everything right, but nobody had checked her vitamin D. Nobody had told her that darker skin plus indoor life plus perimenopause is a perfect storm for deficiency. And nobody had explained that the clock change, that sudden drop in daylight, would push her symptoms over the edge. We fixed it. Within 6 weeks, her fog lifted, her words came back, and her mood was stable. When daylight savings ended, your light cues shifted. Less morning light, less outdoor exposure, your circadian rhythms wobble. And if your vitamin D was already borderline, the symptoms get louder. And for autistic nervous systems, this hits even harder. We rely on routine. We regulate through predictability. And when the external structure shifts, clocks change, daylight drops, our internal systems feel it immediately. That's not weakness. That's neurobiology. So here's what to do. 3 steps, no guessing. Step 1, get your labs. Ask for a 25 OH vitamin D level. This is the marker that shows your actual status. Don't let anyone tell you you don't need it because of your skin or your diagnosis. Advocate for yourself. Step 2, food first always. Get fatty fish, salmon, sardines, mackerel. Eat egg yolks. Eat UV exposed mushrooms. Eat them with fat. Avocado, olive oil, butter, so your body can actually absorb the vitamin D. If you're supplementing with vitamin D, take that with a fat containing meal. Step 3, get morning light. 5 to 10 minutes. Open the blinds. Step outside if you can. Even on cloudy days, this syncs your circadian rhythm and supports your nervous system. You can add in magnesium rich foods like pumpkin seeds, dark greens, cacao, beans to stabilize mood alongside the vitamin D. And here's a quick note, this is education, not personal medical advice. If you have high calcium, kidney stones, sarcoidosis, parathyroid issues, or you're on medications that interact with vitamin D, please work with your clinician before changing anything. But don't let myths stop you from asking the questions. Your clarity is not optional. So if you're tired of being dismissed, tired of hearing you don't need that when your body is screaming for help, grab my free menopause symptom tracker. It's at drstaceydenise.com/menopause questions. This tracker shows you how to document brain fog, mood crashes, energy dips, word loss, everything so you can walk into your next appointment with data, not just symptoms, because you deserve to be heard. And comment myth below if you've ever been told you don't need vitamin D because of your skin or your diagnosis. I want to hear your story. Let's cut through the noise together.